It's my pleasure to introduce the next two speakers that are also going to tag team the next topic. And those are both members of the Pig Livability Consortium, Dr. Daniel Linhares and Dr. Edison Magalhaes. Dr. Linhares is a professor and the Roy A. Schultz Professor in Swine Medicine at Iowa State University, where he also serves as the Director of Graduate Education in the Department of Veterinary Diagnostic and Production Animal Medicine. His applied research focuses on improving sow herd health and productivity through disease surveillance, risk assessment, and control strategies. He leads the Field Epidemiology Research Group and teaches graduate and professional courses in infectious disease ecology, swine medicine, and field trials. Our other speaker is Dr. Edison Magalhaes, and Edison obtained his degree in veterinary medicine in 2015 in Brazil. After completing that degree, Edison worked as a swine veterinary practitioner in Brazilian swine industry for 4 years, and then in 2019 came to Iowa State University to earn his master's degree in preventative veterinary medicine, and which he completed in 2021, focusing on PRRS area regional control programs. In 23, Edison completed his PhD in population sciences and animal health from the same university, focusing on developing automated models to integrate and analyze swine data collected under field conditions to provide insightful information for decision makers. Currently, Edison is an assistant professor in the Department of Animal Sciences at Iowa State, where he focuses on developing new strategies of data integration and machine learning to help pork producers improve swine performance. Edison also serves as the chair of the U.S. Ship Market Hall Sanitation Working Group, a position that he's been in since 2023. Thank you both, Edison and Daniel, for being here.
Thanks, Jason. All right, now, let's get started, guys. Thanks, Dr. Ross, for the introduction. Like he said, we're going to tag team here, Daniel and I. First of all, it's a pleasure to tag team with Daniel. Like Dr. Ross mentioned, did my master's and PhD with him and continue to work and collaborate together now between the vet med and the animal science. But yeah, today we are here to talk to you guys about sow farm importance on whole herd livability, right? We're going to give you guys some updates, like theoretical updates, but mostly we're going to bring some updates or information from data that we analyze from swine production systems that are our partners in multiple projects. That's our focus for today. Just to get started, we saw this already, right? It was really good presentations before that show that unfortunately our numbers are not improving in any of the arenas, right? Pre-weaning mortality, sow mortality. We still have, as Daniel says, it's a low-hanging fruit for us in the industry. And 1/3 of the pigs that die from birth to market, if you think about stillbirths, mummies, all the way to the packing plant, that's a lot of pigs. And that was in 2013, a number that was reported there. And just by looking at the National Pork Board, the recent report from last year, the numbers are pretty much the same. So we would go from 15.77 total born down to 10.87 market pigs per sow in the industry. So pre-weaning mortality, opportunity here, 25% is a big number. I think you guys are going to see some other presentations. And having worked in Brazil before and now being here in the US for almost 7 years, I think maybe labor is an opportunity. Like Clayton said, where is that trade-off between having labor and cost? So they're going to have some good examples, and I think we're not going to touch bases on this, but we're going to focus on the post-weaning losses, which are smaller than the pre-weaning, but of course they are more costly due to feed numbers. Post-weaning mortality, I like to show this slide, really good literature review presented by Dr. Gebhardt, showing that it's multifactorial. There's a lot of things that would impact post-weaning mortality, and they are interacting to each other, so it's really hard to measure, and there are many confounding factors here. So how do we break that down and understand that post-weaning mortality, what's impacting that, right? Those big numbers, it's hard to answer that question. But when we look at the literature, and that was conducted by Jordan in his work, here are many papers mentioning causes of post-weaning mortality from field research. And many papers would mention any of the sow farm related factors. Most of these papers, they would mention one of those at least. So weaning age, weight, health. Some other factors that would be mentioned would be seasonality, stocking conditions, but we know that sow farm plays a major role in the downstream performance, for example. So why sow farm is the starting point, right? So major thing is if we have healthy, stable sow herds, we know that we're going to have reduced mortality across all phases of production. So having good numbers and having good health is critical to have a really good performance all the way to the packing plant. And if we don't have that, unfortunately, of course, growing mortality could be affected by post-weaning factors, but if we don't do a good job when we wean those pigs, that it's hard to beat the odds and change that direction, so we would expect a lower performance downstream. So the quality of the weaned pig is key, and there will be a lot of research being presented during this great conference. I'm just going to cover these 4 areas here, but basically health is a key, so we're going to focus on that, Daniel and I. But of course, we can't forget about management, biosecurity, and immunity on that. So knowing that livability is multifactorial in swine operations, so as you guys can see here, that's the epidemiological triad. So to have a disease, you have to have factors related to the animal, to the host, to the pathogen itself, and to the environment. And like we saw in that previous chart, in that causal diagram, they are interacting to each other all the time. And that interaction is dynamic. Good thing is we collect data. I would say we don't have a really good data, but with the data that we have today, we can do a good job on integrating that. So that's what I'm going to show you guys, kind of how we do it in this approach that we have been working for a couple years, Daniel and myself, and we continue to focus on these efforts. So this is we call the Prosper project. I'm going to show some of those results, but Daniel also from the Pump project. But basically the concept is, okay, let's investigate post-weaning mortality. So we know that sow plays a major role, sow farm. Let's focus on integrating what happens from birth to market, and not only productivity, but information from diagnostics, nutrition, management factors. Are they doing split suckling or not, for example? How that translates not to the weaning, but all the way to the packing plant. And just a quick example of how that would look like, if we look here at the far right, that would be a closeout. That closeout in one company, that guy could have received pigs from multiple sow farms in different weeks of production. So you may have, for example, have a rotavirus on sow farm 1 on week 1. So how can we track that information all the way to the packing plant? And then go to 2 nurseries, different weeks. So our goal here with this integration piece component is to connect all phases of production from breeding to market in a way that, okay, now we're going to analyze that closeout. Now I can have diagnostic information from the sow farm that's filled that group, kind of like a background check. So I have a high mortality, post-weaning mortality group. Now we can try to better understand what's going on there, right, based on the trends. And when we analyze that data, this was a work published back in 2022, but we analyzed data for almost 1,300 of groups, almost 4 million pigs, and build a multivariable model, a bunch of information from sow farm to the packing plant. And interesting for us here, most of the variables that you guys are seeing here on the right are the variables that remained significant in the model for explaining post-weaning mortality. And what can we see there? Pretty much they are all sow farm variables. So showing here 68% of the variation on wean to finish mortality in this system was explained by sow farm factors. Of course, that may change if you have sow farms that are, I don't know, in Hawaii and you don't have PRRS, but if you are like in under pressure, especially on disease, that's translate back to what we are talking on quality of weaned pigs. And okay, let's start looking at the numbers. So these are results from a multivariable model. It's not only looking at one piece. So this, for example, on the left side here, on the y-axis is the wean to finish mortality, and on the x-axis is the sow farm PRRS status. So the status of the sow farm for PRRS when they weaned the pigs and how they performed downstream. And we can see here that the category 1A, that would be the PRRS epidemic, within the first 16 weeks after an outbreak, they had the highest wean-to-finish mortality downstream compared to the low prevalence or vaccinated groups, right? You can do this one.
And it's not only about if I am infected or not, it's also understanding how many of different strains are infecting the sow farm. You heard Dr. Holtkamp earlier talking about the emergency of new variants. And this work by Giovanni Trevisan doing whole genome sequencing of PRRS viruses after sow farms report outbreaks. And it's pretty clear if you measure the piglet losses throughout the outbreak, it's much higher losses when there are multiple strains infecting the sow farm compared to just one or two. So diversity matters, right? The more we're saying PRRS is bad, yeah, but there's not just one PRRS. A lot of times it's a cloud of viruses, and the more you can reduce that viral diversity affecting the region, the system, the better you can expect in terms of reducing the clinical consequences of the outbreaks.
And that's important. One thing just to point out here is, so this is like a sow farm, the diagnostic reports from the sow farms showing these numbers of strains. That information that was like previously not being used, now connected to the groups and following all the way downstream. For example, so you can look at lineage, at the number of strains like Daniel is saying. So this is important to show those interactions. So keep talking about health here. So mycoplasma was mentioned today. Maybe PRRS is too hard to beat, but we have really good examples in the industry, in the US swine industry. And I can tell you guys, like, for example, people talk about Brazil, but they have to learn with the US on eliminating disease. For example, myco is a low-hanging fruit that they are not focusing there. And here we are doing a really good job. And still, we can see, for example, when compare on the x-axis here is the status of the flows for myco, we can see a 2.8% increase on endemic myco groups compared to negative sow farm flows. So importance, for example, not only PRRS, but mycoplasma. Here's PD, where they broke down PD by, let's say, the red. The 0 is the first 3 weeks after the break. The 1 is from week 4 all the way to stop shedding, so let's say the low prevalence. But we can see that both scenarios, the acute phase and the low prevalence, let's say for PDV, they had higher nursery mortality compared to the other ones. So PDV also impacts on mortality. We can see that downstream. And then those numbers that translate, in my opinion, so what is a good farrowing rate? Not saying that you have to improve or decrease farrowing rate or focus on total born or decrease total born. I think here is showing like a perspective of how good the sow farm is performing, the quality overall. So farrowing rate is a good indicator. So when we see that the farrowing rate is the lowest quartile here, so the 25% population that is in the worst side, lower than 84% farrowing rate, those groups downstream, they also translated to higher wean-to-finish mortality. And pre-weaning mortality is the same thing. So the highest the pre-weaning mortality back in the sow farm, that also translated to higher wean-to-finish mortality. Weaning age, so on the x-axis we have different weaning age categories. So from 15 days to up to 20 days of age, and we can see that visually here, we can see a trend that as you move to the right, you have a better, let's say a lower wean-to-finish mortality. So improving weaning age, increasing, we have a higher, lower mortality. But for PRRS, which is this number 2 here, the category 2, PRRS epidemic flows across all weaning ages, it was higher than compared to negative or endemic flows. So that shows importance of the interaction of weaning age and disease. But we can see here that, for example, the highest weaning age and still PRRS epidemic had a better performance compared to, let's say, the worst scenario, which is young pigs and PRRS epidemic. And weaning age, don't look at the average. So this is just a summary of 150,000 liter weaning age. And we can see that the average is like 21 days, but we can see the tails, right? Liters with 14, 15, 16, 18. And when we connect those liters to their respective nursery groups, which in this case were 349 nursery groups, here's the proportion of young pigs less than 18 days within the nursery. So for example, this bar here, 12% of the pigs in that nursery had less than 18 days of age. So that's an opportunity because you have also some groups with pretty much half of the pigs they're young. So don't look at the weaning age by itself on the average. You need to look at the distribution within a group, the variation. And that's also work that team showed, our student with Daniel and myself, the variation of weaning age by filling days. So the longer you take to fill the site, of course, you have a different weaning age from the first load to the last one. And we can see that the higher standard deviation, the higher the variation of weaning age within a nursery group, you also would see a higher wean to finish nursery mortality here. Weaning weight, also important thing here. So the top one here with 8.6% nursery mortality are groups that came from the quartile 1 that had the lowest weaning weight. So as you improve the weaning weight in this data, you also see a decrease of decreasing nursery mortality. So altogether, that goes, this is data from the previous 2 years, but altogether it goes with, for example, what Dr. Mensch saw back in 2004, right? Weaning age, specifically on that one, improving post-weaning mortality and growth rate. So there's opportunity here for us in the industry. And altogether, like Dr. Ross mentioned, I'm a vet, but also a data geek guy, so this is a machine learning analysis. Basically, each circle is a closeout, a nursery group, and on the left side, on the y-axis, we have the nursery mortality of each group. And here we created a score, a weaning quality score, kind of putting all together that we have been talking here so far. Machine learning creates a score for each batch, and we can see that the better the score, let's say the top 10 nursery groups with information available until weaning, they translate in, let's say, lower nursery mortality downstream. So really important to focus here on having cleaner herds, better productivity in the sow farm. That's also translated in lower, better performance downstream.
So far, those results from Edison, what he's really showing is just two important key points here. If you look at the whole herd livability, it really starts in the sow herd, right? It makes sense. It starts in the sow herd, and then the wean to finish performance is just going to be as good as that of the sow herd. If you have a leaky sow herd with leaky, you name PERS, mycoplasma, PD, whatever, the result, the pigs are going to show the results downstream. So if the livability starts in the sow farm, he's also showing that that's got to be explained by something, and that something is called health, right? So healthy sow farms produce piglets of a high weaning quality score, and those are likely to perform well in the growth finish cycle. And if we look back at the cycle of productivity here, our life cycle of producing market pigs, well, it makes sense because it always starts in the sow herd. So what can you expect from a growing pig that's full of disease, right? Even if the sow herd is subclinical, if the pigs are infected, at some point early in the nursery or late in the finishing, that disease is going to come clinically active. So the growth finish performance is going to depend on that of the sow herd, and of course the sow herd includes the gilt development unit. So everything we know about gilt development, gilt acclimation, that's going to translate to that first set for the parity, for the offspring from that parity, first parity gilts, and it's going to translate to the all the way back to the growth finish market. So everything is connected. Achieving growth finish, the full potential in the growth finish really requires a healthy breeding herd in terms of sows and gilts altogether. So I have a finishing problem, 8%, 20%, whatever you name of mortality. How can I fix it? It's a back to the future story. You got to go back to your gilt acclimation, back to the sow herd, and you can't expect a single digit or closer to zero mortality in growth finish if you have unstable disease situations going on in the breeding herd. And we talked about a lot of PRRS, right? Dr. Holtkamp reminded us PRRS is maybe one of the single most important factor in explaining the big, not only averages, but variation in livability here in our country. And this figure represents what happens in a sow herd. Any sow herd, whenever it gets infected with PRRS virus, over time, that red line represents the shedding curve over time, right? So your PCR positivity, whatever you use to measure the virus, we expect a lot of virus in the beginning, and then over time, that pressure of infection is gonna come down because you're not crossing your arms, you're implementing whatever your response plan is. And so immunity is gonna kick in, and for about 20 weeks, almost invariably, you're gonna reach at that low prevalence stage. It could take much longer if you want to eliminate or reach stability, but the reaching low prevalence doesn't take, in most situations, longer than 20 weeks or so. And so at that time, whenever the herd reaches that low prevalence, which can be determined as intermittent detection of PRRS by PCR in processing fluids or tongue fluids or whatever you use for measuring, it's going to be high CT, or some weeks are positive, some weeks are negative. At that point in time, you walk the sow farm to look at the records. It look great, back to baseline, right? So it's completely subclinical. But the sow farm is not negative just yet. And so the productivity impact in the nursery finishing, it's going to extend much longer. It's never going to be, the pigs are never going to reach the full potential if there is some sort of leaking virus in the breeding sows. And Edison, we'll have some data to support this, right, Edison?
So basically, if you guys look here on the far left of that chart, it's pretty much the same one that I showed you guys before. The epidemic flow, so the first 16 weeks after an outbreak, those weaned pigs, they had a bad performance in terms of wean to finish mortality. But if you look at the second one, the 1B low prevalence, exactly what Daniel is saying, oh, I'm doing a good job there in terms of wean to finish mortality. They are not as bad. They are pretty much the same compared to the stable herds that I have for PRRS. Can you move to the next one, Daniel? So those guys there, they're pretty much similar. So if you don't look, let's say, focus on the big picture here, if you just focus on mortality, you might think that you are doing a good job. But can you move to the next one? So there's no difference there. But when the same data, next slide, the same data we are seeing here on the y-axis is the different outcome. So here's not mortality, but it's a proportion of lightweight pigs marketed within each group. So we would see now the opposite. Even though the low prevalence groups, the second one from the left to the right, didn't have a high, let's say it was the same mortality compared to the stable groups, now for the proportion of lightweight pigs marketed within that batch, it was pretty much similar to the epidemic flows. So that was for carcass weight. The company decided what is a cutoff for considering as a light pigs, and they had pretty much similar numbers there.
And so we're saying here, whole herd livability depends on health. Health, it's a lot of PRRS, and so we need your help here to answer this question. So a lot of presentations, we say, put your phone down. Here we're going to say, bring your phone up, and scan this code if you can. And answer this simple question with one word. If you want to use more than one word, it's fine, but we're going to see here results live in a little quick, and it's going to generate what they call the word cloud. And so the idea is to see what's your opinion here on what's the primary source of PRRS virus in the industry. So when your sow herds get infected, where did that come from? When your nursery get infected, where did that come from?
Mm-hmm. Just give a couple of seconds for you guys to answer the question. I think we may try now. So, yep, that's coming live. Nice then. Looks like people, a big one, transportation.
Yeah. Good. 35 still typing, 131 in, 136 in. We see a lot of people, trucks, transport. We're all going to talk all about that during the conference. Lateral, finishing pigs, transportation is coming up, so the bigger the word, the more responses related to that one you guys are saying. So a lot of consensus around people and transportation. Air, transport and transportation.
I don't see any.
Right, a lot of different factors.
Nobody's blaming the vets or the nutritionists. So.
Yeah, it's good. 174, that's awesome. We can share those results with you if you like later, but let's keep advancing. And if we look at the data in terms of what we see in the labs, in terms of macro epidemiology, of where do we see that virus coming on first, it's pretty safe to say today that grow finish is our hotspot. You mentioned people, you mentioned transportation, you mentioned a lot of different things there, but those things are all connected to grow finish. And we see 4 bullet points here. The spikes in viral activity, if you want to pick PRRS, go with PRRS, PD, and influenza is going to be the same thing. The seasonal activity of the detection of those viruses and diagnosis of those viruses, it first starts in the grow finish, and then a few weeks later, that positivity spikes in the breeding herd. At any given period of time in the year, PCR positivity is going to be much higher in grow finish than sow herds. And when we look at the new variants, today we have over 100 variants of virus circulating in the industry. When we look, let's look at just when those start, whenever there's a new variant, where is that detected first? Well, most of them, some 80% or so, are gonna first be detected in grow finish. And it, again, makes sense. It's a lot of commingling, it's a lot of pigs there, so opportunities for the virus to recombine, to change, to evolve. And so most of the new variants we see today, they're first detected in grow finish, and they find ways through, you named it, transportation, people, a lot of connections to the sow farm. Enough of problems, right? We were talking a lot of problems here. What can we do? So Edison and I here are going to talk a little bit about some solutions. Of course, biosecurity. Dr. Holtkamp mentioned about biosecurity, and guess what? Biosecurity works. A lot of companies we work with, they have their own biosecurity scoring systems, in some shape or form measuring biosecurity, and whatever you use, we've worked with many scores in the past, they all correlate with frequency of outbreaks. So the better biosecurity, the less outbreaks you're gonna see. But biosecurity is great, but we gotta keep pushing ourselves as an industry to not only think about the sow farm, but also incorporate the grow finish. And if the grow finish is the hotspot for virus circulation, if the grow finish is where the viruses emerge, if the grow finish is what connects the new viruses back to the sow farm, we need to also get harder and more serious on biocontainment in that grow finish. And there are several strategies, you know better than I do, on how to contain the viruses in the finishing. And then keep implementing the tools. There has never been as many tools as we have today for frequently monitoring the sow herds, for quickly spotting whenever there is an outbreak, and take advantage of data, like Edison is talking about here, to do ongoing monitoring. Paul Yaskin and I was talking about that last night at dinner, looking at things like aborts, sows of feed, water disappearance, any other KPIs. Those are all in the cloud today and available on a daily basis, not monthly, not weekly, but daily. So if we're incorporating those in our monitoring programs, it's an great opportunity for early screening here the herds for problems, and then you can quickly act and implement your disease outbreak response, whatever that is. So been great to see from the lab perspective at the university, seeing that the industry moved. If we look 15 years ago, a standard for PRRS monitoring would be monthly serum sample, pull 30 serum samples, and that's fine. If you look with some clinics doing more seriously, they were doing 60. But today it's much more efficient, cheaper, higher sensitivity, and makes more sense doing aggregated samples. Things like processing fluids, family of, or oral fluids, tongue fluids, you name, right? So a lot of different opportunities here. And so today, we have much better cyber infrastructure to manage and share results than we've ever had in the industry. Programs that allows monitoring close what's going on after the outbreak, and then benchmarking within between systems, systems to understand the macro epidemiology of disease activity in the industry, the diagnostic labs with same-day results, and keep improving what they offer in terms of diagnostics, incorporating the whole genome sequencing, for example, as a tool, systems tracking incidence and prevalence of diseases in the industry, stuff that Edison is talking about here today, doing system-specific field trials and understanding the impact of diseases under very specific conditions. And there's also the US chip that you may be familiar with that could be whatever we want. Today, the US chip is for continuity of business in the event of foreign animal disease introduction, but the partnership between federal, state, industry, academia, everybody else is there, and it could be whatever we want, so why not use for endemic diseases as well? We have better knowledge on how to use effective tools from vaccines for biocontainment and for reducing the clinical consequences, to understanding the PRRS lineages, the PRRS classification, the similar classifications for PED and mycoplasma and other diseases are also available. People using more and more Power BI-like tools to manage what's going on in their own systems, and domestic and international experiences going from not only herd level, but regional or national level disease elimination. And that's where we would like to end here, is push ourselves. We're here to push ourselves, right, in this conference. And I don't think the industry is gonna make much more significant results if we keep acting farm by farm, right? It's gotta evolve to go back to the next generation area regional control. Edison, you work with that with your master's degree.
Yeah, I think that was a work that we did just for that the regional control project was basically. Can you go back on that? Yep. So that was basically to put all the pieces together that we've been talking. So ARC's programs, they were like a hot topic a couple years ago. So we see that this opportunity, we saw this opportunity to maybe revamp those, so bring them together, pretty much doing what Daniel said. So in my opinion, that's by Edison's opinion, but if you want to tackle PRRS, you cannot use one of those tools alone. That would be everything that we have new today, the populational-based samples, data, everything, but you need to focus on a regional approach. So that was the goal of that one, is to put all the pieces together, specifically focus on PRRS. So automated tools, collaboration based on contingency plans, looking at, like, say, real-time monitoring of which site is getting infected or being positive based on automated connection with the VDL data. And as soon as that is positive, you trigger an alert and you stop bringing pigs, or you may do vaccination to stop shedding as a biocontainment strategy. So that was, I'm not saying that that's the perfect protocol. That was only what we did together with Reed Phillips folks at that time, and opportunity to be updated. But anyways, if you want to tackle PRRS, I would think about something like that, a regional approach, and how do you put all the pieces together, and especially populational-based sample and data science, so real-time data analysis and alert.
And I was at another conference here a couple of days ago where Giovanni presented this slide. I took a picture of it because I liked it, and they said that they said that a lot of times it's not about creating, it's about copying and amplifying the good messages, right? So here's a good slide he had on the different industry organizations and initiatives toward PD elimination, not at one farm or not from one region, but for the whole country. And the organizations such as AASV and US Sheep and the United States Animal Health coming together with different resolutions and behind PD. And PD is great, so I think we should keep challenging ourselves. All right, PD is great, let's move forward with that. And how about mycoplasma? How about PRRS? I think it's time for us to get serious on some of those. I'm sure it's not going to be, nobody's saying that's going to be easy, but I've been reading a lot of papers. This one caught my attention really good. It's a white paper here from Scott D. and Gordon Spronk, and in that publication they were pushing for what are we doing in the industry? Why are we still living with PRRS, right? So they lay out in that paper some 6 non-negotiables that goes around biosecurity, traceability, everything that the U.S. sheep has in terms of backbone, and pushing the industry to get rid of it. And so final thoughts we had here for today is the U.S. producers today, we lose over $1 billion to preventable diseases. And got an important word there is preventable diseases, right? We do lose a lot of money for a lot of opportunity for diseases. You saw Daryl's presentation. We rank pretty low here on farm mortality. So relatively, the U.S. industry has one of the highest global pig liver mortality. So that cannot be acceptable. That cannot be acceptable. Swine health is perhaps the most significant factor for livability. So again, we're not saying it's going to be simple. We're not going to say it's going to be, yeah, let's a no-brainer, let's go back together and let's do this. But we do need to fight back, I think. And we have the tools and knowledge. And doing nothing, it's really going to increase the problems over time, right? PRRS is going to continue to evolve. Every time it replicates in pigs, natural selection makes it more aggressive. So something to think about as a reflection is it's time to fight back and start, not start, but continue to get rid of those diseases and close the gaps in livability with countries like Brazil today. So with that, Joe, we'll turn back to you.